Welcome and thank you for joining the NEHA National Webinar Series. Today we will be focusing on public health threats from waterborne pathogens. This includes drinking water, recreational waters, and unregulated aerosol sources, such as cooling towers and decorative water features. I'm Christy Denbrock, Chief Learning Officer at NEHA, and I'll be your moderator today. Our presenters include Dr. David Kraus. Dr. Kraus is the founder of Healthcare Consulting and Contracting. He received his doctorate in Environmental and Occupational Health and Master's of Science in Public Health Toxicology from the University of South Florida. For 6 years, he served with the Florida Department of Health. Joining him is Robert McNeely. Robert is a certified industrial hygienist who received his Master's of Science in Industrial Hygiene from Montana Tech. He is also the Chief of Operations for Healthcare Consulting and Contracting. We ask that you please write your questions into the chat box and we will address them at the end of the presentation. If you are not a NEHA member and you enjoy this session, we invite you to become one at neha.org. So gentlemen, I know we have a lot of information to get covered today, so we will begin. However, Dr. Kraus, I just spoke with our executive director, Dr. David Dijak, and he is in California speaking to your association, the AIHA, while you are here with us, thank you very much, speaking to our association. Do you want to just for a second get us up to speed on your organization, the AIHA?
Absolutely. And Christy, thank you for inviting me today to present on this important subject. Dr. Dijak and myself have been talking about cross-training and education and efforts between the American Industrial Hygiene Association and the National Environmental Health Association. Both are organizations that I've been involved with throughout my career. And it just is, we couldn't have planned it any better to have the discussions on the same day at the same time on opposite ends of the country. But today we're going to delve into something that is near and dear to my heart and subject of quite a bit of my research and consulting over the past 20 plus years. For the industrial hygienists who predominantly have worked in the field of occupational health, we sometimes forget that they are also charged with helping to protect the communities that they serve. I would say that Legionnaires disease is a increasing pathogen that we are worried about, and that the greatest place and time that we can intercede and prevent cases is in the workplace, because typically outbreaks occur where it's a workplace for someone. So we're going to start today with Mr. McNeely. My colleague, will begin with the presentation, and Robert, hopefully going to share this screen.
Again, and thank you both for presenting, and I will go on mute and we will just begin. Thank you.
Thank you.
All right. Hello, everybody. I'm definitely excited to talk with David on the subject. It's something that we both have done for a while. And, both of us will be kind of interchanging throughout the presentation, talking about different subjects when it comes to this subject. Right. So I'm just going to give a little background on Legionella as a waterborne pathogen. It's obviously a pathogenic group of aerobic gram-negative bacteria capable of causing a respiratory disease, legionellosis. Often it is found in soils, actually soil-borne bacteria, and in natural water sources. The problem is, however, is it can pose a health risk when it colonizes and grows in man-made water systems. There are more than 62 species, 70 serogroups identified, and more each each year seem to be. Legionella pneumophila is the most common associated with disease. And studies have shown that Legionella is present in upwards of 70% of all municipality water and hospital plumbing systems. Now, it is not the only waterborne pathogen, obviously, and there are other waterborne pathogens. A report from the CDC that was done a few years ago showed the healthcare costs of waterborne pathogens caused 7 million infections and the water and from waterborne pathogens, and that the cost was over $3.33 billion in 1 year. Most hospitalizations and deaths were from the biofilm-associated pathogens. These pathogens are NTMs, so non-tuberculous mycobacteria, Pseudomonas, and Legionella. Now, Legionella is the most recognized premise plumbing biofilm associated with that is a waterborne pathogen. And the reason why, everybody knows about Legionella and it's nationally notified, it's been nationally notifiable disease for over 40 years. It, especially more recently, has caused more fatalities than other waterborne pathogens in the US. And that's even in totality, more than all of them combined. With that, however, it ranks third in hospital and healthcare costs because NTMs and Pseudomonas are causing more people to be hospitalized, but Legionella is causing more fatalities. So we use, and because of this, for what we're biofilm-associated pathogens, we use Legionella as a proxy organism. And this is Legionella is not the sole important waterborne pathogen, but it is readily available for analysis. And it has a relatively short analysis time. NTMs take up to months to get a full analysis on them, and where Legionella is 2 weeks. It causes the same type of diseases. It inhabits the same aquatic environments, has similar interactions with amoeba and protozoa, and poses similar challenges to control or manage within water systems. But again, we have much more surveillance on environmental sources and relevant concentrations and Legionella associated with disease. We do know about this disease and we have a lot of information about it. And Dave is going to also speak about how that is so.
Thank you, Robert. Absolutely. As you can see from the graph ahead of you, this is the number of Legionnaires' disease cases reported annually based upon surveillance data published by the Centers for Disease Control and Prevention. Just looking at this is not a trend or pattern of a disease that is going away or steady state, but one that is ever increasing, with the highest levels seen back in 2018, approaching 10,000 cases per year. These are not normalized by population, and there's some other reasons for that, but just raw cases, this is what it's looked like since 1995. These are some incidence rates of Legionnaire's disease in the U.S. As you can see, it's certainly increased from state to state, and the latest data that is published in this form shows, it's broadly impacting across the United States in 2017. It's on the rise, and there's really no changes. There's been a few changes in that the CSTE, the Council for State and Territorial Epidemiologists, their case definitions and surveillance is really oriented to outbreaks. Typically, there's not an investigation other than a survey of individuals until there is deemed to be 2 or more cases that are epidemiologically linked to a single facility or location within a calendar year. It is a passive surveillance system, so it's fully recognized by public health officials as well as the National Academies of Science and Engineering and Math or Medicine, looking at the underreporting of Legionnaires' disease. And while we may only be seeing up to 10,000 cases per year, there are estimates somewhere between 50 and 70,000 cases per year, probably more accurate. Over 95% of cases are not that are reported. These are confirmed cases of Legionnaires' disease that would be laboratory diagnostic, are not associated with an outbreak. So we're only looking at 4 to 5% of the cases that are reported every year. Only those are mostly being evaluated by public health. Public health officials only perform or oversee investigations about outbreaks of disease. Typically, there's little to no involvement or further investigation of individual or sporadic cases unless they're in healthcare. That's been changing from state to state depending on the available resources and local rules and regulations. It is a reactionary response. These have not been historically capable of preventing disease. So for up until 2015, recommendations were to really do nothing. Don't look, don't monitor, don't prevent, don't take action until you have a number of cases of disease. And unfortunately, the mortality rates of these are fairly high. In healthcare, the estimated mortality rate is around 1 in 4. And in sporadic cases, it's approximately 10%, so 1 in 10, which while it is a rare disease to contract, if you do contract it, you're got a fairly decent chance of succumbing to it. However, we're going to look at this chart. This brings it out a little bit further to number of cases reported out to 2022. Obviously, 2020, 2021, 2022 were impacted by COVID. And I think these data suffer from an overworked public health organizations throughout the country. But it also probably reflects the relative shutdown of travel, resorts, and healthcare facilities, and focusing on what they're doing. But this is what it's looked like since 1995. There's certainly some patterns and trends we should probably talk about here. So I'm going to look at the same chart here, and we're looking again annually, end of year reports on the base, and on the vertical we're looking at thousands of cases. So if we look just in that first 10 years, and again, we have data going back to 1977, I believe. But if we just look at the 10 years prior to 2002, that include 2002, on average, we're about 1,260 cases of Legionnaires' disease reported annually. And you can see that's a fairly flat curve. Between 2002 and 2003, you see a 70% increase in cases. And this was examined in a study, in research performed by members of the CDC. And they had some ideas of what may have caused this. However, when we look at the next set of data, it's a pretty steady rise. And if we aggregate the data over that next 10 years, you'll see on average we're at 3,010 cases per year, and which is a 2.4 times higher average rating. So we're taking a lot of the noise out of this, but that's a substantial range in this type of disease pattern. And then in 2012, we see another inflection point, and now we're looking at on average 6,951 cases aggregated over those 10 years, and which is 5.5 times higher than the preceding 10 years prior to 2002, and 2.3 times higher than the preceding 10 years. So definitely not a flat curve or leveling off. We may want to asked, or it certainly prompted me to ask, what happened in those inflection points? What happened in 2002? What happened in 2012? And one of those things was that we implemented under the Safe Drinking Water Act, stage one, the disinfection byproduct rules was implemented then, and then stage two was implemented in 2012. And these efforts were mainly to prevent the production and elevated levels of total trihalomethanes, haloacetic acids, disinfection byproducts that are caused by organic matter in the water reacting with chlorine. Unfortunately, when we did this, it appears in my practice, again, I've been practicing across this entire charted period, we've been seeing less and less free chlorine making it to the buildings. And so we may be seeing an unintended consequence of the efforts to reduce cancer risk by having an increased number of cases. Again, these are inflection points. There's not been a full study to look at this evaluation, but it's certainly something worth consideration forward. So what is the biology and ecology of Legionella? Well, it's a Nemophila, which is a species that is most associated with pneumonia diseases, Legionnaires disease. This bacteria is commonly found in all surface waters and many municipal water systems at very low or undetectable levels. Legionella Nemophila requires specific but not very unusual conditions for it to amplify, become virulent or disease-causing, and for it to become aerosolized. So it seems to really like the habitats that we've created for it in these man-made water systems. And then it is contracted primarily through inhalation of an aerosol mist. It's not known to be shown to be contracted from ingestion or through skin contact. Certainly, there's only been one suspected reported case where they think it may have been associated with a person-to-person contact transmission, but that's a case report. It's areas where you might find misting going on, certainly in workplaces, any type of shower is a prime area for exposure. We'll get into that a little bit later. Again, with the ecology of Legionella, you've got, decorative water features. You've got, this is an example of a cooling tower, potable water systems, pipes that they go into. In general, water it favors water temperatures between 68 and 126. It can survive in all of those. It does have an ideal range, and my colleague and I, Robert, were just talking about that. It's the ultimate Goldilocks bacteria. It likes all of its parameters just in the right range. So, municipal water source is a source of inoculation of buildings and water systems. So that is often the goal contributing common factor for a lot of these sources. I think we all have to acknowledge that there's no magic here. There's no spontaneous generation of bacteria. They inoculate water systems, buildings and cooling towers, hot tubs, and decorative water features from the water that they're served by. So foreign material in the water system seems to help protect and give it a ride on organic matter coming in. It is an obligate aerobic gram-negative bacteria, so it does require oxygen, a certain amount of oxygen, in order to live, to become virulent. Stagnation of water tends to improve its conditions, but stagnation again is on the continuum. It's a variability, so it's not a totally stagnant water, but it certainly needs to be a certain amount of stagnation tends to make it more better habitat. Essentially, there's two types of organisms, two areas within the pipes or within a water source that we're dealing with. It seems to be amplifying quite often in the biofilm. So at that surface layer and that biofilm surface layer of in the pipes or water heaters or in the hot tub. But then what we're essentially exposed to is what is in the planktonic or free floating form. Sediments in the system tend to improve its conditions. It seems to interact with protozoa and amoeba in the water that also seem to make it become more virulent or infectious and able to cause infection in the humans. And then, of course, shutting down and recharging a water system tends to result in an increase in concentrations that may be dislodged from the surfaces, that may be introduced to buildings or into other water sources, and are often associated with outbreaks in the coming days. Robert?
So let's talk about where we can find a Legionella exposure and where it can occur. We have a little photo here just to show you that sometimes you don't really think about it. Here you are, just doing your dishes and everything and don't think very much about it. But almost every single water source that is like this, where it's putting out a stream of water, there is some type of aerosolization. As you see here, when you really zoom in, it's putting out a lot of droplets. So that's where, we always have to be keeping that in mind. Where's the exposure? It could be washing hands. It could be brushing teeth. Now, obviously, the brushing teeth itself is not that, but it's in the time that you're having water running. It's in the bottom. You're having aerosolization. Showers. Everybody knows about the showering. I think that's the first place a lot of people look. Now, I want to stay on these, that not all of these have the amount of exposure, or, because it could be with how long it is and the amount it is, and how far it is away from an individual where the source is. But all of these can be and have been either anecdotally or proven that these are sources. Hot tubs are known. Decorative fountains, which great mist. A lot of people don't think about those. And then drinking fountains. There's been a lot of, there's been anecdotal information on that people can maybe inhale, inhalation of the water, aspiration, that there could be exposure there. And then at work, fresh air intakes from near cooling towers. You do have some guidance out there that says, hey, look, don't put your air intakes too close to cooling towers or within 100 feet. I think some of that is not really understanding how cooling towers work, but you're probably more likely to get exposed outside than inside. But there's all these exposures can occur. Receiving therapy pools, respiratory therapy. If you don't maintain the pools, there could be issues. Now, these are not all of the different, there's a lot of different types of exposures that you can do. Like I said, if there's some type of running water that is creating some type of aerosolization, it can get some type of exposure. Here, I just wanted to show some exemplars of things that you could be looking at. Here is a water feature inside an office building that, the water looks fairly pristine, and you don't really see huge aerosolization. And then when you actually look at the water, you can actually see that it is not that clean. At this location, they were perceived, it was one of those self-maintained kind of systems that they thought they didn't have to do anything with. And unfortunately, the receptionist that was sitting in the area actually contracted Legionnaires and died. And so this is an exemplar of, where they could be. And you don't really see a huge amount of aerosolization because, you don't always see it all, but you always have to look at these.
Yeah, perceptibly, there was little aerosolization that people perceived was coming off of this, but there actually was.
Yeah. There was, yeah. there's, you also have to look at different kinds of features. For example, feature the main thing about this one is they didn't treat the water because it had actual plants in it. And so they treated the water, it would kill off the plants. And so you always have to keep these things into account. And even though it doesn't look like it's creating a huge amount of aerosol, it's creating enough. You got parks and stuff where they're doing, putting out water features, to try to keep people cool during the summer. And as you can see, if you can see it, don't think that's that mist or that steam, because it's not producing enough heat to produce steam. That's aerosolization right there. And then again, another water feature, that cause issues. Now this one, I think this is also a good example. Some people think that, oh wow, it's too small, and it can't be a source. Well, this one was a situation where the water that was in there and was creating a little bit of mist. But the thing is that what the individual had was on the other side of this little water feature, they had a fan that they were keeping cool with that was actually blowing the mist into their face. And so it, caused the exposure. So you're always, even though you don't, some things are too really small, some things are really big, that we always look at, here, cooling towers. Everybody thinks about cooling towers when they think about Legionella. Sometimes that's the only thing they think about. And the thing about cooling towers, they really have to think about is that you could have a cooling tower that is hitting all its parameters, even having low HPCs, hydrophilic plate counts, and still have a huge amount of Legionella. I mean, the water could look pristine and still have large quantities, concentrations, high concentrations of Legionella. And then bad ones might not, you might think, oh, wow, this is going to be definitely positive. And it's not. There isn't any. Hot tubs are notorious, as we all know. And the biggest thing about hot tubs that, from our experience is, just because somebody says they're treating it really well and they have all the documentation, we find out that generally they're not very well maintained. The thing about hot tubs is that it doesn't take very much of an individual for the parameters in a hot tub to drastically change. And this is and about hot tubs is, yes, public hot tubs do generally have some local health department and some local guidance or regulations, but personal hot tubs do not. And so they're unregulated. There's, very little true guidance out there, or at least easily obtained guidance on how to maintain them. And they're, can be definitely a source. And you can see there's a lot of aerosolization going on.
Thank you, Robert. As you can see, we know a lot about Legionnaire's disease and many of the sources, but the reality is there's still much to be learned. And having practiced in this area for a couple of decades, there has been a lot of information that was dogma, that was commonly known information that was published and recommended 20 years ago, 10 years ago, and is no longer recognized to be protective or reliable or what we really need to be doing. So one of the big things we wanted to try to tackle here was dispelling some myths. And we're going to kind of go through these. I ask people to, please put your questions as we go through, as you're thinking them, into the chat. But these are some of the myths that, industrial hygienists have carry with them. Many public health officials still carry with them. And certainly building owners and operators may certainly have heard something in the past. So one is that HVAC or air conditioning systems are sources of exposure. Many people have equated this to the air handling units that are inside the buildings and the condensate or the cooling coils, and even some publications have recently come out and said that with no evidence or basis for it. The conditions are just not right for Legionella to grow in these. It is the cooling towers, which are the outside components of a HVAC system. So that's one in which we really need to decouple that. Swimming pools and hot tubs are thrown out there, and often a lot of time and resources are spent testing swimming pools. And you may find Legionella at low concentrations in swimming pools or their filters, but there's never been an outbreak or individual case that's been definitively linked or really shown to be caused by its exposure to a swimming pool. Often there's a hot tub right next to it. And again, you don't have to be in the hot tub to be exposed to the mist from the hot tub. But swimming pools, while they may be present there, the aerosolization and the concentrations of Legionella we find there are often de minimis and not the issue. Grocery store produce misters. We've always looked at them. I've heard myths and tells, but I think it's more like the Yeti. I've heard it, but I've never seen one. We see the misters. We don't see outbreaks in grocery stores commonly reported. I have looked at misters quite a bit in other areas. They're typically not recirculated water, and that recirculation of water seems to be a factor in the increased risk. Swamp coolers. If you're in the southeast, you don't know what these are. If you're in the southwest, California, Nevada, yes, we sometimes find Legionella in these, but there simply haven't been a huge number of cases or outbreaks that have been seen in those, and the mechanisms are often not clear. Irrigation and sprinkler systems, we've looked for them, we'll sometimes find it in there. Again, exposures are often either impossible or not likely, and finding Legionella in these, we're not sure how to fully interpret that. Fire suppression lines, again, those sprinkler systems often sit stagnant for years and are often not well maintained. So again, not often a major source. Dirty pumps. How did the Legionella get into this building? Pumps were dirty, is the assertion or claims that are often made, but not really one that we can rely upon. And that Legionella is a building-related problem, and that is true. That it's not in the municipal water supply. That is often an unfounded statement. We find this in many municipal water systems on a repeated basis all across the country doing testing. So it is recognized to be a source of inoculation to these buildings. Most recently, there's an interesting story in Grand Rapids, Minnesota, not Grand Rapids, Michigan. Just last month, reported 14 cases over the course since April 2023 that they identified that the municipal water system was the only common exposure source where people were getting sick. And that this testing suggested by the health department that the two buildings that were impacted had the same type of organisms as they were finding in respiratory samples from the people. So this is one of the first times that we've seen an acknowledgement, recognition that the municipal water supply is the common source of exposure, even though they're being exposed at building. I would offer that not treating your water system with chlorine at all is one thing, but in many municipal water systems, there's no levels of effective chlorine being delivered to facilities anyway. So certainly one story in the situation to continue watching. So again, it's not treated with any chlorine. Air handling units, condensate pans. I'll say I've inspected and assessed thousands of air handling systems across the country. A lot of nasty things can grow within air handling units and coils and condensate pans. Legionella is on. Again, aerosol sources, cooling tower remediations, and recommendations of 100 feet for a cooling tower. Again, I don't know any basis for this. Often cooling towers cause outbreaks in communities. They're community-wide. They're widespread. They're affecting often people who aren't even in the building where the cooling tower is present. So why 100 feet? And often we see that there's really no detectable aerosols in the area close to the cooling tower because it acts more like an umbrella effect. Where did the 100 feet come from? I have no idea if that has any. I've never seen any evidence for that. Shower heads and sink aerators, frankly, recommendations to remove and disinfect them. That sounds nice. If you've ever tried to do it, cool. If you've ever tried to do it to 1,300 of them in a hotel, just replace them. the effort necessary to clean them and remediate them, and then to have any confidence that it worked far exceeds the cost and effort to just replace them. Checking inside a shower head for biofilm. I don't know how one would do that, but shower heads are not something you can just peel open and take a look at. Assume that if you have a surface that has had constant water contact and periodic contact with the air, it has biofilm. Biofilm is not unusual. It's present everywhere. Everywhere we have plumbing and water pipes. Legionella is not. Another myth is that Legionella is only a hot water problem. There's still people and organizations that believe we only need to treat the hot water. Tell me that when the water is 89 degrees in Dallas, Texas in summertime, 90 degrees in South Georgia. So you don't have to have hot water or heated water. Sometimes the cold water is plenty impacted. Then, so the question you should always ask is, what level of disinfectants are necessary to control Legionella? And that should be one of the driving factors. Often it is much more than you realize. Talk a little bit about that later. Again, levels of exposure. Wrong button. Again, this is what some of these aerosol misters look like. And again, if you have significant levels of Legionella in this water, I can imagine it would create quite an exposure, but we simply haven't seen the patterns described. Occupational settings where people are exposed every day to mists like this. If it's a straight through non-recirculating system, we've not seen evidence that it's a significant source. Humidifiers, not dehumidifiers, humidifiers. Whether they be small, larger, these can be significant sources of amplification and growth. Knowing the difference between whether it's steam or not steam is critical. And the ones that are not steam are simply putting out a fine mist of air, fine mist of water. This is called the Bradley sink, and I would challenge anyone here to look to see if you can find the biofilm inside this aerator. This type of sink is more like an octopus. You step on a pedal at the floor, and it shoots out water sprays everywhere. There's no practical way to treat, disinfect, or remediate this type of system. So we've seen that these were, when they do become contaminated, they're almost impossible to remediate. Pressure washers, anything that is pushing water out at high pressure can create tremendous aerosol mist. We've seen impacts from this when that water source is contaminated. Again, who disinfects their water tanks on their pressure washers? Hoses, and an area that we haven't really talked about here in the United States is, I would say, for the most part, never looked at, is vehicle-mounted tanks used for. This one was on one in Spain where they had an outbreak of asphalt grinding machine, which uses dust or fine water mist to settle down the dust. And they found that this was a source. This is one where I think we should be looking at frequently in outbreak situations as a possible moving source of Legionnaires disease. I'll talk about some of the pitfalls and errors that we see during outbreak investigations that I've run into over 2 decades of dealing with Legionnaires. Walking into a situation with an a priori conclusion as to what the source is. It's got to be a coolant tower. It's got to be the hot tub. It's got to be this. When you put on blinders, you're going to be blindsided. Apophenia. Seeing a pattern when there isn't one there. Deciding that the sample results or conditions you see are the cause of the outbreak or the exposure, and not going about in a scientific manner. Ruling out other sources is another initial pitfall. Prematurely dismissing or ignoring water sources, ruling them out, and failing to collect any samples during the relevant time. Not sampling the municipal water supply. Not understanding the water quality, the conditions, and the organisms that may be coming in with that. not measuring residual disinfectant levels, not maintaining a written chain of custody for samples. They do get mixed up. Taking too few samples to assess the risk of exposure. I'm sorry, in a 54-story building, taking 12 samples is not enough. Relying upon non-culture-based analysis methods. They may have a role in all of this, and trying to use PCR or other rapid assays may help you make decisions, but if you use them to the exclusion of culture-based methods, you can find yourself with a lot of inconclusive data. Using an inexperienced, or worse yet, I say there's a clinical lab to measure or analyze Legionella in environmental water samples. It is not their forte. So in walking into outbreaks, I would say that these are the top missteps often taken at the very beginning. Robert?
Negative. So let's talk about assessing building water systems. One of the things you do need to do, you have to take water and swab samples. And when you do it, you need to make sure that you submit them to a laboratory for analysis, for culture analysis. The laboratories must analyze samples by culture methods. I mean, one of the methods is ISO, I think it's 11731. And you need to make sure that they do analyze by that. The problem is that you have some of them that will culture, and you might not get a detection limit that you really are looking for. And sometimes they don't even really let you know what they are. You need to do do the analysis. Sometimes an analysis takes 10 to 14 days. You can get prelims 4 to 5, and we're showing that prelims on some labs, not all, that those prelims are fairly accurate going out 4 or 5 days. And so substantial delays between time a sample is collected and results are available. That's really kind of a problem when you are doing an assessment of buildings, and you need to keep that into your calculations when you're communicating with tenants and owners and so on. And that's where when you're talking about that is the non-reliability of biological surrogates exist, where HPC and PCR, which David talked about, are not really, you can use them as a tool, but they should not be your primary source of getting information. Risk factors for water system colonization. So these are the risk factors that we really look at. Source water containing Legionella at some level. The thing is that you could take a sample of incoming water and show that it's non-detect. That just means it's not detectable by the method. Does not mean it's not there. And also, if you need to look at other parameters within the water, also because you could have no chlorine and nothing coming into your building that is going to help you. And so that's why the low disinfection levels in water is very, very important. And sometimes, a lot of times, they're absent coming into the building. So if they're absent coming into the building, that means they're none throughout the building. And then temperatures are important, but not as important as disinfectant. And really, it should be taken with a grain of salt when it comes to temperatures. I know a lot of people in the past have been putting a lot of emphasis on temperatures, but really they are not what we should be really concentrating on. Especially levels of dissolved oxygen and nutrients. And that's what we're talking about, like stagnant water. If it's stagnant for long enough, it's not gonna have high levels of oxygen, but also is, if they have some type of aeration, you're going to be increasing the oxygen level and nutrients. Protozoa and amoeba being present are also should be part of the risk factor. And it also, with those, it also has to do with maybe how virulent these organisms are. Circulated heated water, large multiple story buildings. Seems like the larger, the more at risk. Periodic use of long periods of water stagnation. That's where stagnation, there's that Goldilocks that me and Dr. Krause talked about is, if it's constantly being stagnated, then it's going to dissipate the oxygen, dissipate everything, and you're going to have problems. Also, pitfalls and errors during routine monitoring, not sampling the water source. Again, that's a big pitfall. If you're not doing that, then you really don't know what the water is going to the building. And so you're not really knowing what you're dealing with within the building. Overreacted to sporadic low levels of non-pneumophila detection results. I've seen people freak out about it. Even the health departments just freak out about that. And then also not reacting enough to low or non-detectable levels of disinfectant. Those are very important. And that's probably the most important control that we have at the moment is disinfectant, more than heat, more than anything else. And so if we make sure the disinfectant is there, the control is generally there. Relying upon hot water as a control, it has been shown way too many times now that temperature is not a control, or at least not a very effective one. Too few samples during monitoring in locations, that is a big pitfall. Not taking enough samples, so you're trying to make a conclusion on this. Confusion between verification and validation. Verification is just saying, hey, look, are the controls in place? Yes. But validation is making sure that the controls are functional, that they are working, and then accepting a high detection limit for samples. We have seen it where somebody's showing, we're non-detect, and you look at their analyticals and it's 800 CFU per million. You're like, wait a second, that's way too high. What do you can't extrapolate anything from a detection limit that high, and making too many assumptions. I mean, we all make assumptions, it's natural human reaction, but just going in and really thinking that must be it can be a pitfall. Pitfall and errors again, post remediation. Again, not sampling the source water. Plenty of times I've seen it coming in where the remediation was actually successful, but the problem is that the water coming into the building will contain Legionella. So throughout the building, we were getting positives on Legionella. I've seen that multiple times after disinfection and after post-remediation. Ineffective remediation due to, the pH is too high, especially on some systems. We're looking at 9.5 on the pH. Most oxidants will not work at that, or are completely ineffective. They're not in the right form to be disinfectant. Not physically removing the algae scale and the biofilm. That's very important also. And trying to clean and sanitize at the same time. That's a big no-no. You need to clean and then sanitize. They should be separate. Not collecting post-remediation samples. We see that a lot, especially sometimes health departments say, yeah, just go ahead and remediate. Excuse me, just go ahead and remediate. And we'll call it good. Not good, because then it comes back. Collecting post-remediation samples too soon. Sorry. That can be a problem too. Relying on non-culture-based analysis. Yeah, the post-remediation is not the way to go, because sometimes you're wrong and missing the rebound. One time's rebound, that's what happens.
Okay, we're approaching the end of our time here, but I do want to quickly just talk about water management plans on a very high level. They were first recommended in ASHRAE 188 in 2015. Aside from healthcare facilities, they are currently still voluntary. Water management plans do not require or even recommend sampling for Legionella. However, to validate that a program is working is required, and culture-based sampling is the only way I know of how to validate a program intended to control the pathogens. So there are no reliable surrogates, and even though it doesn't tell you to sample, I don't know how you do that, how you validate the program's effectiveness without some type of samples for the organism you're trying to control. Water management plans do not ensure or guarantee that an outbreak will not occur. In publication, a reference later here and provide the links to in this presentation. They evaluated 14 outbreaks. 57% of those, 8 of 14, had a water management plan in place during the outbreak. Had problems. I would say that if effectively designed and implemented, a water management plan can monitor the risk reduction and corrective actions, but still may not be protective if it's not fully implemented and well managed. Don't assume, in conclusions, don't assume that levels of disinfection are able to control fecal-associated pathogens are also able to kill, inactivate, or inhibit Legionella. It's a fairly robust organism for a variety of reasons. We've given it an ideal habitat to live in our water systems and our buildings. Municipal water systems should always be assessed and evaluated for their possible role in Legionella introduction to the building and a lack of disinfectant and colonization that it allows, and possible distribution to multiple buildings in an environment or in a community. And just because you find the organism, let's say Legionella jordanus, or some other non-Nemophila species, or even Legionella nemophila, if you find it in a source, and that it doesn't mean that it's amplifying. It's important to get some level of quantification. Just presence or absence is not enough to make public health decisions or risk-based decisions. So amplification is the important part. And I encourage everyone, question the basis for all the assumptions that you're taking into an investigation and how you're interpreting those results. And ask, is it evidence-based? Not just, is it the way we've always done it? Not, is it just, this is how I was taught? Not, is it, it seemed like a good idea at the time. But what's the evidence to support this decision? These are some of the references that we provided. Encourage you to educate yourself. American Industrial Hygiene Association, of which I'm a member, co-authored several documents and guidelines on recognition, evaluation, and control of Legionella in building water systems, and also a framework for competencies that professionals should know and be able to carry out as part of professional care. If you have any questions, we encourage you to reach out to us at hc3fl.com. You have myself and Mr. McNeely's email addresses here. We'd love to speak on this subject and provide whatever education, training, experience, or feedback we can to folks who are faced with having to do these investigations. I want to thank everyone for your time today.
Dr. Krause and Robert, thank you so much for this informative session. And you have a lot of questions. We have about 10 minutes left, so we're going to go through a few. We will have the questions answered later on by both our distinguished guests, and we will send them to all the attendees along with a link to the video on the NEHA YouTube channel. So let's jump into some of these questions, shall we? The very first one we received was, which solutions do you recommend for Legionella?
Solutions being prevention strategies. Well, we certainly have recognized, and even CDC has recognized and acknowledged in their latest 2021 guidance, heat treatment and shock treatment is not an effective long-term remedial measure. Often it is in disinfection and remediation, depends on the water source. Cooling tower, non-potable water system is going to have different ones than potable water system in the building. And for a hot tub, we have seen wonderful success, I'll say, comparing to other remediation solutions for potable water systems using monochloramine long-term, much better than what we've seen in chlorine dioxide, free residual chlorine.
Okay. The next question is, does the water hardness matter?
It's not a direct implicator on Legionella survivability or culture, but is often an important water parameter that can interfere with control measures such as disinfectant levels. So it does, but controlling it by itself is not going to solve or prevent the problem.
Okay, moving on. Should institutions of higher education have a Legionella prevention plan in place? And even though most of the campus population is outside of what we would consider to be highly susceptible to Legionella?
I believe that perception is prevalent, that most universities and educational facilities, that's not your at-risk population, but they don't teach themselves. A lot of old farts like me are out there doing the education and training, and professors education staff, maintenance staff, administrators. And on these universities, it's not uncommon to have clinics, members of the community visit to enjoy the football game or the basketball game, to come in and seek medical attention and be research associates, subject in research. So it is not a young person's only location. So absolutely, water management plans can and protection of these is absolutely necessary, because universities are part of a larger community, and if they're not protecting their own staff, then they're not protecting the community as well.
Thank you for that. Another question that came in is, have you seen possible exposure in airplanes, the faucets in the restrooms?
That is potential. There are procedures, having worked with airlines, there are procedures in place to disinfect the bunkered water on a regular basis. But that is a potential. I doubt it would happen from, within the bunkered system itself, but if it's receiving water from a contaminated source, that is certainly possible.
Okay, we have a question regarding the example you gave us. And this question is, was the receptionist's illness reported as work-related with OSHA? And how active should OSHA be?
Well, I don't know if it was ever reported as a work-related illness. It was, I believe it was actually at a location and for an employer that isn't responsive to OSHA. So not all workplaces, only private sector workplaces have to comply with or deal with OSHA. County, state, city, universities, schools, they are not required to comply with OSHA. So I don't.
Okay. I think we have time for one more question, but like I said, we have quite a few, which we will send them to you so you can answer them.
Wonderful.
This one is, how are municipal water supplies being inoculated with the lines, breaks, and repairs?
We believe the most likely source is during construction, installation, water main breaks, losses in water pressure, that the soil organisms inoculate those distribution lines downstream of the plant. But there have been a number of studies that have found Legionella in the reservoirs and the water tanks that where that water is being held after it's been treated. So it doesn't take much. Just there's seeds that inoculate material downstream. Robert?
Hey, yeah, I just want to add on that is most municipalities, they don't just create their water; they're grabbing it from nature, this organism is naturally in the reservoirs that a lot of municipalities grab their water from, and so they try their best to try to rid the water of it before they supply it to you. But it's like Dr. Cross has said, it's very hardy organism and it can handle a lot. And so they try their best, but they're not 100%. And so when they do supply it to you, and what it does is, again, like he says, it gets into the pipes and everything of the system, and it can grow there also through the biofilm of the system of the municipality. And so, and then when they go through, and that's where, and then that's where you get it. Sometimes they'll be, especially you get peaks. I've seen peaks of it where they go in and start doing their work in these, on the pipes that they're supplying, water to you from, and knock a lot of the stuff loose, and then you all of a sudden get a big.
And ultimately, municipal water systems under the Safe Drinking Water Act are not required to test for Legionella. It's not part of their regulatory requirements, nor do they typically test for it, and there's no MCL for Legionella in the water. So most of the time, they have a big blind spot.
Well, we have so many interesting questions. I'd really like to ask you more, but unfortunately, we are out of time. But we will send the questions to our presenters. They will answer them, and we will send them to you in attendance. So, gentlemen, again, thank you so much for joining us today. And we might have to come back and do this again. It sounds like, and it looks like from the chat box. So I'll most likely be reaching out to you to do a part 2 if you don't mind.
Thank
And
you for
so-
having me.
It's our pleasure.
Okay.
Thank you.
Thank you,
Thank you.
everyone who joined us today. We appreciate your attendance. And please fill out the survey that you will receive. That helps us to get your feedback to help us to continue to provide these type of webinars and also with the topics you're interested in. And with that, on behalf of Neha and all my colleagues, I will say thank you once again, and everyone enjoy the rest of your day.